Okay, this video is about fatty liver. And by the way, I've made several other videos about fatty liver. So you can just type in the search menu for my channel, fatty liver, and you'll find them pretty fast. Okay, so fatty liver management. Typically what happens is the patient walks in the doctor's office, they check their LFTs, liver function tests, and they're elevated. By the way, tons of patients have elevated LFTs, and whenever I see a requisition for an ultrasound of the liver because of elevated LFTs, in my opinion, you really don't need to check an ultrasound, in my opinion. I'll tell you why. Because they're almost always in a new patient due to, with isolated elevated LFTs, they're almost always due to fatty liver, okay? You know, you get some old alcoholic, they might have cirrhosis, okay? But your typical walker, talker, off the street, young, middle-aged patient with a beer belly, which they're probably going to have fatty liver. Okay, so then what's the typical treatment for fatty liver? The typical treatment, and usually in the Western world these days, is they tell them don't drink alcohol. That's good advice because drinking alcohol causes fatty liver. They will also then tell them to lose weight. That's nice, but the patient doesn't know how to lose weight on their own. They might give them Ozempic. They'll tell the patient to exercise more, which is nice, but doesn't make that big a difference. They'll tell the patient maybe, oh, your cholesterol's high, put them on a statin for their cholesterol. They'll say, oh, you're pre-diabetic, diabetic, maybe recommend treating them with metformin, which is a mitochondrial inhibitor. And the mechanism of diabetes, insulin resistance, is primarily high-fat diets causing mitochondrial inhibition at a different location than metformin does. Metformin is more like at the beginning of electron transport of the inner mitochondrial membrane, whereas fat's more like in the middle of it. Then they will also tell the patient, you know, they'll say consider other medications perhaps if the triglycerides in the blood are elevated, or like I said, they may even put them on something for obesity, Ozempic, etc. They often get put on hypertensive medications as well. They're often hypertensive. But here's the big point. They typically recommend the Mediterranean diet. You go to the famous medical center channels and see what they recommend for these patients. They'll recommend the Mediterranean diet quite often. And they'll say with nuts, 80% fat, 70 to 90% fat, seeds, super fat, chicken, super fat, fish, olive oil, which is completely stupid. You know, it's the old joke. It's like Nathan Pritikin used to say, the American Diabetic Association diet is guaranteed to make sure that the patient always has diabetes. And this diet, to me, sounds like it's guaranteed to make sure the patient never gets better from fatty liver. So, what am I recommending? Okay, and by the way, how does this usually play out in real life? Well, in the Western world, when the patients continue eating something like the Mediterranean diet or some modified version of that, they usually don't lose any significant weight. They usually don't improve their liver very much. They come for a follow-up ultrasound of their liver about a year later, let's say. It typically still has fatty liver. Their LFTs are typically still elevated. It's stupid, okay? So what would I recommend? Well, why not put them on the diet, the only diet known to reverse coronary artery disease, the one that Kempner used to cure diabetic retinopathy, hypertensive retinopathy, severe hypertension, some autoimmune disease like psoriasis, to help with kidney dysfunction. The low-fat, low-sodium vegan diet, I mean, it's obvious with no oil. It's obvious, and that gets people to lose weight most of the time towards their optimal body weight. It's just totally obvious.